Welcome to the third day of the summer school. To briefly introduce myself, my name is Humanis Fandiari. I'm a postdoctoral fellow here at the Balgrist University Hospital and in the Research in Orthopedic Computer Science Lab. And I'm very interested to be hosting this third day of the summer school, packed with a very interesting line of keynote speakers, and to hear more about their research in areas ranging from signal processing, vibroacoustic analysis, sonification, arts, philosophies, sociology, and surgery, not to forget about that. And first up, we have Dr. Linda Brützel from Brainlab to give us the keynote. Brainlab is a privately held German medical technology company headquartered in Munich, Bavaria. Brainlab develops software and hardware for radiotherapy and radiosurgery and the surgical fields of neurosurgery, ENT and maxillofacial surgery, spine surgery, and trauma interventions. They have recently also announced their work on mixed reality platform for immersive patient data monitoring. Dr. Brützel has a PhD in physics in the area of biophysics and molecular materials. Very welcome to this keynote. Dr. Brützel, you can start sharing your slides now.
Hello, thanks a lot for the nice introduction. Let's see if I can share. Yeah, it's this one, share, and we see share sound as well. Okay, perfect. Yeah, thanks a lot for the nice introduction and very happy to be here. Yeah, and before I want to talk about mixed reality, I also want to quickly talk something or give you an introduction our company. I mean, this is a little bit maybe redundant because you nicely introduced our company already, but still, so the company was founded in 1989 by our CEO, Stefan Filzmeier, and his vision was to provide medical software and also hardware for oncology and surgery. And what is actually very interesting, I think, that he started studying and then he wrote a book about 3D visualization, and this made him very famous, so that he quit his studies and then started the company. And yeah, we still exist and provide very cool software and hardware. And as I said, what started with a few employees and cool ideas has become a very successful company. So today we count around 1,800 employees, which work in 20 offices all around the world. And the headquarters is still located in Munich, and most of the research and the development is here. But we also have development done, for instance, in Israel. Yeah, and the others are more sales and marketing or support in the other countries. So as already mentioned in the introduction, we focus on the clinical segments that we are active in, focus on neurosurgery. This is like the main part, then oncology, also a lot of radiotherapy, then orthopedics with the focus on spinal surgery, CMF and ENT surgery. Brainlab is first and foremost a software company, and our core products center around surgical navigation, radiotherapy, digital operating room integration, and of course a lot of also data transfer, information and knowledge exchange. But over the years, the development of hardware system has also become quite crucial to our company. So we have different navigation platforms, patient positioning systems, and also intraoperative imaging system. And today, yeah, over 5,900 hospitals use our technology. So a lot of them are in Europe, but also in the US and some in other countries, as you can see here. And I think what makes our company very special and also differentiates from other medical technology companies is the continuous eager, which is a lot of driven by our CEO, to integrate new technologies into the healthcare sector. So here are just some examples. So for instance, we have integrated in our cranial navigation system augmented reality. Then we recently launched a quite elaborative or also quite complicated but very nice patient positioning system. We also have robotics and also quite recently mixed reality, which I want to talk about now. But first, I want to give you a short introduction, or kind of also the motivation why we think mixed reality might be beneficial for surgery. So in surgical planning, but also for surgical diagnosis, the main or the basic prerequisites are images. So these are from magnetic resonance imaging or computer tomography, or also ultrasound. And we at Brainlab are mainly interested in, or focusing so far in, MRI scans or CT scans. And for different diagnosis or treatment plannings, different modalities are used. And for all these, or the two different techniques, we have different settings. So for instance, you have different scanners, then you can run different protocols, or the resolution may vary depending on the slide thickness that you define. You can focus on different region of interest, or apply contrast agents, for instance, an MRI scans or CT if you want to see the vascular structures. And this means that the required information can be spread across different data sets or scans. And therefore, the surgeon has to do a profound image analysis to kind of come to a correct conclusion for the diagnosis, or decide on the correct treatment planning. And we at Brainlab offer, for this case, a software suite that is called Elements. And this software suite contains different software modules, as you can see here, and they are aimed to assist the surgeon within the planning, and also to make the workflow more efficient, and finally also, or hopefully, allow for a better patient outcome. Here I just show you some examples. So we have, for instance, one module which is called Image Fusion, that allows two different data sets to be fused. So for instance, MRI and CT scans are also the same images from the same technology, but preoperative, that were scanned preoperatively or intraoperatively. And then these scans are automatically fused either rigidly or elastically. Then we also have, and I think there we are kind of leading in the market, an automatic segmentation algorithm. And this software automatically determines the different functional structures. And this is done by, you have your patient data, and then we have a synthetic tissue model, and then the patient data are kind of compared to the synthetic tissue model, and then the software automatically outlines these structures. Here are some examples for the brain. And then in the end, the surgeon just has to verify. And of course, he still has the option to also manually make some small corrections. And in addition, you can also see then the corresponding 3D model here. We also have a semi-automatic segmentation module, which I can show you here in the video. This is made to outline pathological structures, as for instance here, we have a tumor in the liver, and then the surgeon just has to outline this with this brushing functionality in the axial scan, and do the same thing in the sagittal slice, as you can see here. And based on these two outlines, the software then reconstructs the corresponding 3D model. And this is much more, or much easier than going to do this outlining slice by slice, really, and saves also a lot of time. Okay, but one challenge in surgery still is that based on these 2D data, you have to make the transfer to get a 3D understanding. So imagine you are now in a surgery, and your patient is lying in front of you, you're a surgeon, you have your navigation system installed, and then you're standing here, you look at the screen with the segmented data, but you still have to overcome the challenge to get the 3D representation or the 3D model of your patient based on these 2D screen data. And one software module that we offer in addition is our viewer, which displays both 2D data with the segmented objects that you can see here, but also the corresponding 3D models. And with our rendering and visualization styles, we always try to get the highly advanced realistic visualization. For instance, here we have a tumor where we have a special texture representing a more realistic tumor outline. And we can get these 3D models for different functional structures, but also different anatomical regions in the body. So for instance, here you see the head, so more cranial applications, then also CMF is here, spinal applications. Here you see a liver model, and also vascular structures. This is an aneurysm in the brain. And we are also always trying to get more structures for objects not in the brain or associated with spinal procedures. So here, for instance, we have the representation or the segmentation of a liver with a tumor, but also we have, this is a prototype, so still not available, but this is a representation of the lung and the bronchs, also containing a tumor here, and then also more visceral related structures like a kidney, for instance, here. But still, the question is, from the 3D model, what is the best way to allow the user to interact and get the most content out of these 3D models? So, as I said, we have this 3D visualization viewing software application, which we launched in 2009. And in 2016, we introduced 3D stereoscopic display. Therefore, the user has to wear some specific glasses to get this stereoscopic view. And then in 2019, we finally launched our mixed reality technology, which I now want to talk about finally. So our mixed reality viewing application is enabled by our partner Magic Leap. So we entered into a strategic partnership with Magic Leap to launch this product. And here Brainlab makes the software, our mixed reality viewing software, which is CE and FDA cleared. And then we have the Magic Leap platform that consists of a head-mounted display that you can see here, a light pack that is kind of a mini computer, and then the controller that allows the user to interact with the digital content. And for those of you who are not so familiar with this technology, so in the head-mounted display, you have different cameras that kind of scan the room, and then also always know where the position of the user is, which wears the head-mounted display, and then it positions these stereoscopic images in the room accordingly. And what we had to overcome at the beginning is that this technology was mainly associated with gaming, and also surgeon that were like mixed reality, Brainlab, what is this? We're very skeptical. So one challenge was at the beginning that we had to bring mixed reality into the healthcare, and therefore one prerequisite was that we have to make it easy, because surgeons always don't have much time. So we need to make sure that the technology can be easy integrated into their workflow. And how we do this is, so the surgeon starts the viewing application, then he puts on the headset. With the headset, he has to scan a QR code, and then the mixed reality session is established. So these 3D models that you've seen previously are then transferred into the real world. And today up to 4 users can join one session and interact with these models. Another thing is that also when you wear the headset, in comparison to or in contrast to VR, so virtual reality, you still see your surrounding. It's just enriched by this virtual content, but still, I think it's at the beginning quite difficult to orient yourself. So what we did, we integrated a positioning marker. This is just a piece of paper that the user has to look first, and then he has to align a virtual arrow that is displayed in his headset with the real arrow, and then all the digital content are kind of aligned to this origin. This can be considered as a coordinate origin. And then this makes also sure that if you are in a multiple user session, all participants see the virtual content at the same position, and you can look like really focus on the object. And then we also integrated some transparent lines to the 2D data and the 3D model to kind of give a guideline when to orient yourself and to find the objects. And then, as I already said at the beginning, we have the controller, which has this laser icon here popping up, this laser sword coming out, and this allows the users to interact. And this is very beneficial if you're in a multi-user scenario. So you actually see the laser points of every user. We have different input parameters that indicate or that trigger different actions. And here's one example how this looks. So also we integrated an interaction menu where the user can then choose from different applications what he can do. For instance, here we have an eraser or cropping tool that allows the user to crop out bony structures out of the head, and for instance, to simulate a craniotomy. So this is just one example. And now I want to talk a little bit more about the use cases and some experience from our customers. So what you can do with the technology, and therefore I would like to show you a short video. I hope this works. Oops, sorry. Yeah, so this is of course a bit animated, but it kind of combines all the application where we currently use it. Sorry, start again. So where the product is currently used is patient education. Most of the surgeons use it for surgical planning review, but also for medical education. So what you saw in the video with the old lady, this is kind of patient education that a lot of surgeons say that to discuss cases, especially very delicate or complicated cases, it's much more intuitive, and the patient better understands what is actually done by really diving into these 3D models, and the surgeon explains what the procedure will look like. Then also what I already said at the beginning, this transfer from 2D to 3D, really getting the 3D anatomy of the patient and discuss how to best approach it and plan the approach and the trajectory. And then also we see a lot of interest from surgeons for medical education, so for residents, but also really in teaching scenarios within anatomy labs. So this is what we currently get a lot of as feedback. And I also want to show you two use cases, or two cases where customers but also cooperation partner use the technology. So one example happened last year in the US. So here you can see this was used for twins that were connected at the head, and they had to be separated. And this case lasted 24 hours, the surgery, and 30 surgeons were involved to discuss the case and see about the treatment. And they used different technologies for imaging and also to analyze how to best do the surgery. And here they also used mixed reality, so to visualize the 3D models of these little girls. And there it was very important to get also the vascular structure of the head. And this is really one big advantage of mixed reality, that you see the relationship and how the vessels and the arteries flow and go in the head. And what was very nice, actually, within an interview of one surgeon, they said that this is definitely not gaming. So I think we really overcame this suspicion at the beginning that mixed reality is just for gaming or just a toy within surgery and not really relevant or doesn't show any benefit. And in the end, these two little girls were successfully then, the surgery was very successfully and they are all healthy and well up. So this is one example. And then one other example that I would like to show you, this is not in the intended use of the current product, but I think nicely shows what can be done also in the future with this technology. And this relates to percutaneous procedures in neurosurgery. So here we have the indication is the trigeminal neuralgia, which refers to patients or people where this trigeminal neuralgia nerve, or this trigeminal nerve, this carries sensation from your face to your brain. And if you suffer from this, even mild stimulation of your face, such, for instance, brushing your teeth or putting up makeup, trigger a lot of pain. And this can occur up to 100 times per day. So it's very painful for these people. And how to treat this is one approach, that the patient is awake and the surgeon then has to place a needle, and then with a radio frequency, the pain is relieved. And therefore, if we look into the brain, the surgeon has to do a cannulation of the ganglion with a needle and has to hit a target structure, the foramen ovale, which is 37 square millimeters. And of course, he can't look into the face. So he really has to go with the needle through this foramen ovale and figure out the point where the patient feels most pain. And this is very difficult. And at the moment, this is done manually. So based on anatomical landmarks, following the so-called Hartel's approach. And what they did, this is a work done in the Uniklinikum in Freiburg by Dr. Reinacher and his colleagues. And what they did is they created they did a scan of a phantom. And then they placed a virtual trajectory through this foramen ovale, and then they manually overlaid the 3D model with the phantom. And then they followed this virtual needle, or this virtual trajectory, with the real needle. And then they repeated this for without mixed reality. And in the outcome, what you can see here, in total, there were 64 needles placed. And the landmark-based approach, so this is really freehand, no guidance, anything. You can see that 9 out of 35 successful approaches were done. And the mean Euclidean distance, so the placed needle to the target needle, was around 12 millimeters. And then if you compare this to the mixed reality-based approach, where you have the virtual 3D model overlaid with the phantom and you follow the virtual trajectory, you could see that 29 out of 35 approaches were successful, and the mean Euclidean distance, so again, the target structure, or the deviation from the placed needle to the target structure, was 5.7 millimeters. And you can see also here, this is like, the red one is the target structure. And then you can see here the yellow and the blue corresponding to the landmark-based approach, manual approach, and the mixed reality-based approach, that also the first attempt were much better or more accurate than in the mixed reality-based approach. So this is one example. As I said, it's still off-label use. So at the moment, we can't use the mixed reality technology at a patient. It's not a medical device yet, but this gives you a nice idea of what can be done in the future, and that we can really achieve, actually show quantitatively that this leads to a benefit in clinical procedures also. In the last few minutes, I want to give you an overview also where we are currently working on, or where we see also the future of mixed reality. So one project that I would like to outline also is that we are involved in a project which is called 5G Giga for Health, which is funded by the Land Nordrhein-Westphalia in Germany, and we have 8 different project partners, one from industry, so university hospitals, but also industry. One big partner is also Vodafone. They want to establish in the Uniklinikum Düsseldorf a 5G medical campus. And Brainlab is also involved there, combining 5G and mixed reality, where we want to establish basically remote collaboration, both for medical education, but also for tumor board meetings. And if you remember our video, here the idea is that you can do these discussion or interdisciplinary surgical planning meetings also remotely. So this is already possible now, that the surgeons are at different locations and they see the virtual model in front of them and they see the laser pointer of themselves, but also from the other participants. But with 5G, we can go at higher speed and with lower latencies. So this is one example. And then in medical education, the same here, also with COVID. I think this whole remote room independent teaching becomes more and more important. And there we want to use or establish a mixed reality based remote collaboration. And then also, this is a bit also referring to the video that you have seen here. We also see a high potential bringing this technology into the OR. So in the future, the surgeon then doesn't have to look at the screens which are far off, but has all the information, the screens, the data that he needs for the surgery in the headset, can interact with these data and screens. You could also imagine getting information about medical devices and instruments as shown here. And then you can do here, this is a spine surgery, do your navigation and your surgery really based on mixed reality only, without the relying on a far off located screen. So this is the vision where we also see a high potential of mixed reality. And with this, I'm done with my talk. I hope you have some question, and we are also currently looking for people, software developers. So if you're interested in our technology or would like to join us, feel free to contact me or anyone else from our company. And thanks a lot for your attention, and I'm happy to take your questions now.
Thank you very much, Dr. Brützel. It was very interesting to hear about all your activities at Brainlab, especially with the focus that you have in the mixed reality domain. We do have some questions from the audience, and I'm just going to read them aloud. Yeah, right here. There's a question from Sharif, and he's asking, in our medical MR community, there are so many cool and promising demos, but we struggle to get them adopted into daily standard of care use. In your experience, have surgeons who have tried the Brainlab MR tools kept using it after the novelty has worn off?
Yes, so there are definitely, so we get a lot of feedback that they use it, really, like they make also every resident use it, and they do it, or they spend more time actually within their surgical planning, which is of course more time efficient or costs more time in the planning, but they see really a benefit in the OR. They say, like within this surgical planning review, especially with residents, they see a much more active participation, and they have the impression that the residents actually now understand much better what the surgeon is actually, or the more experienced surgeon is talking about. And also, but for interdisciplinary approaches, so for instance, if you see in functional neurosurgery SEG cases where you have an epileptologist and a neurosurgeon, they are from very different worlds, and with mixed reality it's much easier to communicate, so they use it a lot. But I have to be honest also, I think we still have to improve the workflow integration a bit. I mean, I showed you what we have done so far, but I think we still have to make it even easier to just that you boot the device and you are automatically connected to our viewing application. Yeah, this is where we still work on, but I always tell people it's like with our smartphones, you know, at the beginning we had these big fat smartphones, and now we have or like cell phones, and now we have smartphones where everything is like super fast and well connected. And I think it also for us needs some time to make it even faster than now. But in general, we get a lot of positive feedback that surgeons really need it use it in their daily routine.
Wonderful, thanks for the response. I have a question coming from myself, actually.
Yes.
Why did you go with augmented reality for the information display that you showed for the brain tumor surgery use case, for instance? Because what I understood was that it's meant for collaborative environments where multiple surgeons, and including the patient themselves, can look at the segmented volume of their brain, for instance. But is there really a necessity to show that in an augmented reality domain fashion instead of putting everything into a virtual reality? Because as far as I understood, there was no registration of the segmented data to the anatomy involved in those demonstrations, at least that we saw.
So I mean, in the video, of course, this is like a theoretical scenario, but what we do is really you have patient specific models. So we get the scans from the patient, and then we segment them and then display them in mixed reality. And what is the advantage of virtual reality? I think that from virtual reality, you very often get a little bit, you feel dizzy or nuisance. And with mixed reality, you still see the other, you are in your physical environment. And then the advantage is really that you can discuss these patient-specific models, interact, but you still see your patient, or the patient still sees the surgeon. And yeah, this is why we chose mixed reality. I don't know if this answers your question.
Absolutely, yeah, thank you very much. Fortunately, we have some more time to go on to the next questions. And I'm going to read out a question coming from Professor Joskovic, who we are fortunate enough to have him in person here in the summer school. He flew in earlier today, and he's asking, what new AR tools do you have for orthopedics?
For orthopedics, at the moment, well, we don't have a special AR tool for orthopedics. I mean, what we are currently working for intraoperative usage is for a minimal invasive spine surgery. Of course, which is like spine navigation, but the current product, the viewer, can also be done for trauma cases, in orthopedics. So we also have segmentation in the orthopedics area available, and then you can review and interact with these models as well. So the viewer is really independent of any surgical discipline. Of course, we have the segmentation that we do we have more options for cranial and spinal procedures because it's our focus.
Excellent. Next question coming in from Steve Patterson. Thank you for another wonderful talk. I'm most interested in the registration for the accuracy of procedures such as the percutaneous procedures. Would you please talk a little more about how you confirmed accuracy in such cases?
Yes, yeah, that's a very good question. So the registration here was really done manually. So by really placing, so what the surgeon did is that they used the 3D model and looked for anatomical landmarks on the phantoms, and then tried to manually align the model according to these landmarks. And the stabilization was then totally relied on the head pose tracking of the headset. And this is where we are also still struggling and looking for a solution, how you can, first of all, either assist the registration process, or using some markers that can be registered by the headset and then place or automatically register it. And also these markers are then there to stabilize the 3D model, because what currently I think everyone who's working with MR devices, so Magic Leap or HoloLens, is the problem that you have a drift of the virtual model, and this is very much influenced by movement in the surrounding or lightning effects. And this is something we have to work on. So definitely something on markers, but we don't have a solution therefore yet.
That explains. Thank you. Next question from Fabio Reina. Amazing. Is this technology currently being overlaid to the patients in surgeries, or is it only being displayed as a complement for the surgeons? And I think we touched on this
Yes,
briefly in the past. So currently, as far as I understood, it's mostly for display. But,
exactly. But in the spine surgery, then we will have like the registered overlay.
Excellent.
Yeah, for surgery.
Next question from Nisal. Is a software that used to construct the 3D models from CT and MRI, are they available to use in research?
Yes, I mean, you can buy them, or with clinical corporations, we also made them available to partners. I mean, for research, it's not an open source software, of course, or you can't, like, we provide the source code and you can work on it. It's more like you can use it, and then based on the outcomes, you can, I don't know, work on that or add something. And it's also, what I have to add is, like, really you install it in your computer, and then you run the algorithms, and then you get the segmented objects within a couple of minutes. I mean, if it's a large data set, it may take some minutes, but it's not like you have to send it to us and we then process the data. It's really integrated in the daily, or on your computer, you can run it.
Excellent, thanks. I guess we still have more time, Matthias, more time. So we can go over the next questions as well. One coming from EA, which actually I'm very interested in hearing your response on this as well. Did you notice difference in performance among different users?
What do you mean with performance on different users?
I think they're referring to the usability study that you were pointing to, like among different surgeons who've used this technology.
Yeah. That's actually quite interesting that for the alignment of the registration process, they said that they had one power user who was very, like, really figured out how to best align it to the phantom model. And then there were actually no real differences between, like, an experienced one or a non-experienced one. So this is, I think, also reported in literature, that one advantage of mixed reality or augmented reality and these overlays is that the experience is kind of not seen in AR application. And this is also what he said then, that with this overlay, they become much better or much faster. The learning curve is very steep to place the needle with that.
Wonderful. There's still enough time to go to the next question, or two more. Sorry to take on your time.
No, all good.
Wonderful. One question that I saw earlier was there a particular reason that you went with Magic Leap instead of HoloLens?
So from why we did this with Magic Leap is that the former CEO, or the founder of Magic Leap, Ronnie Abowitz, he had already much experience in the medical sector, because beforehand he had founded a company. Unfortunately, I forgot the name, but that was one reason that was one advantage of this, that I think for Magic Leap there was always a big interest at bringing this also into the medical sector, and there the requirements are probably a little bit different than for, I don't know, other industry departments. So that's why we chose Magic Leap also.
Excellent. Next question is more on
Maiko was the company. Yeah, just read it in the chat.
Wonderful. Next question is more again on the usability aspects, coming from Sam. Thanks for your fascinating presentation. Adopting the XR technology with this prospective application is a significant challenge for all AR VR products. Do you have any standard method to train medical practitioners about how to work with your technology? If not, how did you do that?
That is actually also a good point, because this is something where I'm as product manager thinking about what is the best way to train people to make it like, and there one thing would be maybe to have an application that is on your headset and shows you like based on a 3D model and gives you an idea what you can do with the headset. What we normally do is at the customer side, we give a half-day training, an introduction, how to use it. But what we also figure out is with this controller, it's very intuitive how to use it and what can be done. And it's a lot of learning by doing. So we get a lot of feedback from surgeons that, of course, they need some time to get used to it, but it's very fast. And they say that especially this young generation of surgeons coming now, there's really a change of how they learn and how they approach medicine, that they are much, for them, it's much easier to interact, and they are much, I also see this in demos. So no offense to experienced surgeons, but I think this young generation, we all are more familiar with like interacting or using digital content.
Excellent. Thanks very much, Dr. Brützel, for the interesting talk and time you took with your detailed responses to the questions. Again, thanks for accepting our invitation, and we can now move on to the next speaker, who is Professor Janine. I'm not sure if Professor Janine is already here on the talk. Please let us know if you're here. Oh, sorry, I'm not sure if you heard my last sentences. I was just asking if Professor Janine is here, but it seems like he's not. And we can either move on to the next talk, or if there are any other burning questions to Dr. Brützel, please put them on the chat box, or to Professor Nava regarding the use of AR and mixed reality in real life applications. Medical applications, of course. You did it. If you still have time, Dr. Brützel, there are some remaining questions that we can
yes, sure.
with you. I remember there was one question regarding the dental implants. Just one second. Yeah, well, there's one again from Sharif. What are the challenges with bringing an AR headset into the sterile field? Which is actually a very interesting question.
Yes, of course, I'm not allowed to talk about everything in detail. But like, I think, of course, there are these regulations. So this is mainly about electricity stuff that you have to, prove. And then, of course, I mean, with the headset that we have to come up with like concept that the surgeon can wear the headset, then also the light pack and the controller, where to put it, and that we have to probably drape it and then make sure that it still not disturbs the clinical workflow, but there's definitely some draping and where to place to put the light pack, for instance, during the surgery. These are questions that we still have to figure out.
Mm-hmm. Thank you. There's a question from Ali Nafa. This was the question I was looking for. Sorry, Ali Nafa, I didn't see that at the beginning. Good presentation. Is there a future for control of robotic surgery using MR?
For robotic surgery?
Robotic surgery, yes.
Yes, so I think that this is also one very interesting field where we already got some feedback from people that, so together with our Zurich robotic instrument and mixed reality, there are definitely some procedures where combining both technologies would make sense in the future.
Absolutely agree. Next question from Matt. Thanks for the talk. How many deployment of the Magic Leap plus Brainlab system do you have globally? First, for preoperative planning, and secondly, intraoperative use. And in both cases, how do surgeons justify the cost to their hospital? Are operations quicker, fewer complications, or are there still research questions remaining?
Yeah, so we have now, I think, sold over 250 devices, and about the number of hospitals, I'm not so sure. I think it's over 60, something like that. And currently they are just used in Europe and in the US and Japan. Japan, we also have installations, because in other countries, magically can't be sold at the moment. For intraoperative usage, surgeons don't use it because it's not allowed. As I said, Magic Leap 1 is not a medical device, so they can be used in the OR to review data, and this is what surgeons do, but not at a patient. So most of them use them for, as I said, in the surgical planning review. And we don't have a proof like at the, like a publication now that this clearly proves that you save surgical time, but we have several clinical cooperations really looking into that and also collecting feedback. So based on questionnaires where they see the benefit, what is useful and not. And I think there was one question about the costs.
Exactly.
Yeah.
They're asking how the surgeons can justify the added cost of, having this integration of mixed reality into their current practice to their hosting hospitals or medical centers in general.
And with cost, it meant like the money or like the time. Sorry, I didn't.
Why don't we go over both aspects?
Yeah, for costs, I would say there's no justification because in comparison to other products that we sell, Magic Leap or the whole viewing software is not very expensive. And so in the time is really that I think that what we got as feedback is that that many surgeons say it's really if I use or spend the time in more planning, I see really a benefit in the understanding, and it's really a mental training for their surgery. So one surgeon, for instance, said it for him it's like a cooking recipe that he one day before the surgery he goes through every step, reviewing the case, and then in the OR he feels much more comfortable. And I think it's especially also beneficial for what one surgeon said is that if you have a surgery lasting 8 hours and you can save some time then for the first several steps which are more routine, then you have more energy for the more delicate part of the surgery where you have to concentrate and remove the tumor, which is more challenging than, doing the skin incision. And this can be fastened or speed up, but we are still lacking like clinical evidence for that. This is mainly based on customer feedback that we get.
Excellent, thank you. One question coming from Abdullah, perhaps a general question: what kind of technical and research expertise are you looking for in Brainlab? And if there are opportunities for internships? I think you mentioned that at the end of your talk.
Yes, there are. So in the viewer team where which is like related to mixed reality, we currently have 2 open positions for software developers, but also in other teams, I think there's some opportunities. Or also for internships, we are always looking for that.
Wonderful. Thanks very much, Dr. Brützel, for your patience and response.
Yeah, thank you for all the questions and for the
time
discussion.
Thanks very much. It was very nice.
It was a pleasure. Thank you.
Likewise. Thanks.